of the day for me, a fantastic speaker. Delighted to welcome for our next keynote is Jacqui Rock, Chief Commercial Officer at NHS England, and it's making NHS commercial practice fit for the future. A very warm welcome for Jacqui, please.
Hey, it's good afternoon now, isn't it? It's gone 12 o'clock, I believe. I didn't get a cup of tea or pastries this time round, so I shall be owed. Great to see you all. Hope you're having a good conference so far. It's always a pleasure to come along to these events and see lots of different people from different sectors, different industries, and a few of us government people are also lurking around if you come and find us. So, yeah, really good to see you all. And today I want to discuss specifically how the NHS commercial and procurement function are supporting the health service. We're in a really challenging environment, and how within that context we can all respond to ensure that the NHS leverages its size and scale and harnesses innovation to deliver an NHS that's fit for the future. So our procurement teams, I will use the language just to explain. In government, we call it commercial, right? So when I'm talking about commercial, what I'm actually referring to is procurement, supply chain, and of course, commercial side of things. So just a little bit about the language that I might be using. So our procurement team in the NHS, we're responsible for 30 billion sterling spend. And if you actually look overall across the entire government, when you look at the health service, so including all the arm's length bodies, Department of Health and Social Care, it's 90 billion sterling of spend. So this is by far the biggest government spend of any department. I used to work in the Ministry of Defence. Yeah, interesting, come from defence into health. You still feel like you're at the battle line, you really do. And we absolutely, we're kind of 2 or 3 sizes bigger than our defence budget, which is still incredibly large. So with that comes a massive responsibility. That's a huge responsibility for how we use that money, how we spend it across all of the categories that we spend it across. And literally, there is not a thing. I challenge the team sometimes. What don't we buy in the NHS or never have? You know, it's not just medical goods and services. It's everything from, paper clips to MRI scanners to transport services. I mean, the size of our estate, the size of, just imagine, I think we clean the equivalent of Gibraltar every day. I mean, it's just talking about square metres. It's because I also run facilities, but that's not this conference. That's another one. And so, it's our job. It's my job to get the very best value out of the taxpayer pound. It's my job to make sure the staff and the patients who rely on the NHS, and they rely on our commercial teams to buy the right goods and the services they need at the right time. So it's there for the frontline staff, so they can focus on, delivering that world-class patient care. I spend a lot of my time out in the system. It's no good sitting in my ivory tower in London. I need to be out in the trusts. I need to be out with the GPs. I need to be out in the mental health facilities, because that's where I see what things are really happening. And it always kind of amuses me. One of a favourite recently was a consultant, a neurosurgeon, who said to me, Jacqui said, it's amazing. He said, I carry out surgery. He said, then I go off for the day. He said, and I come back and the storeroom's magically overnight been replenished. It's like there's little procurement fairies that come along and do it. No, that's the NHS supply chain, which comes into me, which recruits about 3,500 people, and it is one of the biggest logistic companies in the country. Within the NHS, getting those goods, those services, those medicines, those syringes, those scalpels, those gloves, everything you can possibly manage up and down the country to all of our 220 trusts, 24 hours a day, 365 days a year. So commercial procurement's a critical enabler to the NHS. And we've got to transform. We've got to be easier. We've got to be more agile. We've got to be in collaboration with our people, with our suppliers. And when I'm talking about our suppliers, we've got over 80,000 suppliers in the NHS. And I'm sorry, because some of you probably this afternoon will come up and say, can I get a quick coffee with you? I'm not talking about today, but because I want to show you this. And I'm like, God, I've got 80,000 people, it's quite overwhelming in terms of just trying to manage. So do forgive me if you have reached out to me before. I'll just call this out now. I do want to hear about, if you're a supplier, I do want to hear about all the innovations, and we've got particular ways and pathways for people to come in. But forgive me if I can't always promise to a coffee with you. But we are moving the dial, and this is a really difficult landscape. So you're not going to expect me to come here and not talk about what you've all been seeing in the news for the last couple of weeks. So our NHS staff, they continue and always have worked incredibly hard, whether it's a porter, whether it's a nurse, whether it's a resident doctor now. We don't call them junior doctors anymore, just making that point. Whether you're a consultant, whether you are a receptionist, whether you are a paramedic, an ambulance driver, whether you are part of the procurement team, we're all part of the NHS. And they work very, very hard to deliver the best care for patients. But despite these efforts, we know that access and waiting times for many of the services are currently not what we want to provide for patients, and it's not what the public expect. So last week you would have heard the results of Lord Darzi, Aria Darzi's review on the NHS, where we are facing significant challenges. And his review set out and painted a very difficult picture for all of us. We all, most of the people in this room use the NHS. You have family that uses the NHS. We're born, most of us, through the NHS, and ultimately we end of life through the NHS. It's with us for our entire life. So we all feel very, very passionate about it. I know we do. And so it's very, very difficult when reviews and, we're very open and transparent. We say, this is where we are right now. You'll recognise, that people's experiences with primary care, GP access, dentistry, it's not where people need it to be. We recognise that. And the report charts a significant increase. So let's take it into context of the NHS activity and the surge. There's a massive surge in the number of people in the UK suffering from long-term conditions. I could talk for hours about the demographics and the ageing population and the health of the nation, but I'm here to talk about procurement. But please do ask me later, because it is an absolutely significant impact on how the NHS is coping today. So our staff are seeing record numbers of patients despite ageing equipment. It's really ageing, and inadequate buildings. As I said, my other role is I run the NHS estate, and what an estate that is. We've got everything from bright, shiny new hospitals to I run a lot of facilities out of sort of Victorian crumbling buildings. And don't forget, we're still recovering from the pandemic. It's only 2024. The pandemic was 2020. In a normal business cycle, when you think of a disruption of the size and the scale of COVID, most organisations would expect to take at least 10 years to recover, and many of your organisations will be. Well, the NHS, we are still massively recovering from it. It's not really talked about. But make no mistake, we are still recovering from the pandemic. So now we've got a definitive diagnosis of the challenge, right? So now we need to work jointly on the prescription. And, although we are facing unprecedented challenges in the NHS, there are plenty of reasons to be optimistic. And I think this is one of the key things that came out of the review. I think the narrative, the NHS isn't broken, isn't very helpful. But not very helpful for the staff. But nevertheless, that's the narrative that our government has chosen to use. But the important thing in the Darzi review was, but there is a heartbeat. It is not over. It is still, and we've got to reform. So we are committed to working with staff, patients, and the whole of the British community to develop this 10-year reform plan. And you will see there's going to be a massive period of consultation. You won't be able to avoid it. It will be on the news. So we get everybody's voices. And as the report points out, many of the solutions are already there in the NHS today. And we in the commercial space are fully committed to ensuring that we are part of that solution, so that we ensure the NHS recovers from COVID, that we strengthen the foundations and we continue to reform so that it is fit not just for now but for our future generations. So this plan's going to set out a bold agenda, And it's going to deliver on 3 big shifts, which you'll hear a lot about. And if there's something you take away today and you want to talk about what the NHS's aims are, these are the 3 things, the 3 key things. We want to move from a hospital, so a secondary care environment, back into the community. Our hospitals are full of individuals that shouldn't be in hospital. They should be in social care settings. They should be in other settings. We want to move we want to completely transform how you get first access into the medical world in terms of your GP. We want, community diagnostic hubs. I can go on. So that's hospital to community, point 1. Point 2, analog to digital. When I was listening to the presentation earlier, and I listened to the private sector talk about the how you've embraced AI and medtech, and I'll talk about that a little bit further on, and technologies. I'm medtech, many of you aren't. We're a long way behind. We're a long, long way behind in the NHS. And the third thing is we've got to move the whole sort of psyche and narrative from treating sickness and treatments into prevention. We're not very good at that in the UK. Do you remember back when we had Public Health England and they did the things like the Couch to 5K? And we did, the drink driving campaigns. All of these campaigns really do make a difference. It's all gone a bit quiet. It went a bit quiet before COVID. It's gone a bit quiet now. We need to start telling people, if you are this weight, you are at risk of this. If you smoke, you are at risk of this. We need to just start educating the population as well. So we must get into a prevention space. But in the meantime, we're going to remain relentless in our focus to deliver on the improvements and the innovations currently within our gift. We need to drive productivity, we need to reduce the variation, we need to continue to roll out new models of care, such as virtual wards. So what am I doing from a commercial perspective? I thought it was really important to set that narrative. So from a commercial procurement intervention, we've got to look at the ways we spend and how we leverage the market. We have got a crucial role to play in supporting the NHS to deliver on its ambitions. And with the funding that we have, we've got to drive those improvements for now or in the future. So what are we doing? For us, to deliver an NHS for the future, we need a really clear, aligned and strategic approach to how supply chain transformation is going to occur in the NHS. We need a shift in mindset and perspective of the role that supply chain and world-class procurement brings to this company in terms of productivity. And we need to take the recommendations of the Darcy review, and we need to start using that different language. I'm really, really fortunate. I sit on the executive board for the NHS, the EXCO and the NHS board. And the language that I use with predominantly clinicians and the most brilliant men and women I've ever had the fortune to work with. These are the world's best consultants, best, psychiatrists, whatever it is. But, when it comes to procurement, I've got to use language that they understand. And I think often we don't use the right language. So I talk about procurement and supply chain in terms of productivity. I talk about it in terms of efficiencies. I talk about it in very practical terms. When I go out and see the chief execs of trusts, I say, by buying the way you buy this particular service or product, it is costing you X or Y amount more, which actually I can put down to an additional 15 days theatre time, for example. I'm giving random examples. Have to speak the language of your business. And I think that's a key message for me as well today. And I think procurement and supply chain professionals, really important that we start learning how to change that narrative into that productivity, because it's made a massive difference, because people are listening now. So some of the things that we've done so far. So we've introduced several transformation initiatives that underpin and set out the key step changes that need to happen. So number 1, support from the centre. The NHS is a really complex environment. It is 220 trusts, so 220 individual secondary care hospitals, which now we've got into, you have to bear with me on this, 42 integrated care systems. We've then got social care, we've then got primary care, we've got dentistry, we've got ambulance services, and a myriad of arm's length bodies, including blood services, donor. I mean, the list goes on. It's really, really complicated. And what was happening, a couple of years ago, was kind of everybody was doing their own thing. Really, everybody was kind of buying quite separately. In some cases, that's okay. But when you're spending 30 billion of spend, you're not leveraging the market. You're not making the market. You're not actually putting out those signals to the market. And the whole world listens to the NHS. We're really lucky. The whole medical world wants to know what we're buying, what we're doing next, what research, what innovation. And if you're all buying in separate ways, you're just not achieving that. So I set up the central commercial function out of NHS England. And what that's done is it's now brought that community. We've got over 4,000 buyers in the NHS, 4,000 of us. Some are just logistic buyers and some are really, really top professional procurement and supply chain, but we weren't a community. So we've now brought us together as a community, and we are making decisions as a community. We are looking at certain interventions as a community. We are training each other as a community. It's made a significant difference. So that was really important, to bring us together as an NHS central function, which is going to support them in their work and professionalise in that community. We're definitely making better buying decisions and delivering better for our patients. I always use the term, for the greater good, one for all and all for one, but it really does, when the size and the scale of the NHS, it does make a significant difference. The second thing we've done, we've now got one NHS commercial strategy for everyone. Everybody was part of it. It wasn't from sort of head office, the government, the Ministry of Health, or even NHS England. That it was, everybody was involved. So I made sure it was really collaborative. And this is a unified articulation of what we need to do to continue to support the NHS and the patients. It's got 26 interventions over the next 5 years. So really, really practical delivery. I'm a bit tired of strategies that look nice and glossy and never actually get delivered. A strategy for me is a plan. It's about, this is our intent and this is how we're going to do it. So I have the whole of the NHS focused on that one strategy. Third thing, a focus on efficiency and value. This is about honing in on certain areas that need national intervention. We have to drive this change in the system, and we have to offer the best value for money. The opportunity is actually vast and sometimes a little overwhelming in terms of what do you go after first? Which area do we want to go after first? But we're also reaching out to our suppliers to help with that. I'll talk about our suppliers in a minute. So there are some key shifts needed, as we go forward, all of which are supported by the commercial initiatives I've just outlined. And we're going to continue to support the NHS to deliver these. So bear with me. I just want to take you through some of these key shifts. So first of all, and I've just mentioned it a little bit, influence and scale. So leveraging the NHS's influence and scale to strengthen partnerships, foster healthy supply markets and unlock benefits for innovation. This is a key enabler in delivering an NHS fit for the future. We're already doing a lot in this space, and I'm really ambitious in terms of how I'm going to further leverage NHS's scale. You can't be the biggest government department spend and not leverage that and not use that to your advantage. That's scandalous. So we are. And just a couple of quick case studies of things we've done. First thing we did was frameworks. Those of you that deal with government, we like to buy off frameworks. There's many ways you can buy: Crown Commercial Services, NHS Supply Chain, etc. But for the NHS, we had over 1,200 frameworks. We had something like 40 frameworks alone for furniture. Right? It's kind of like, so whether I'm a small innovator or a small SME, or indeed one of the biggest furniture manufacturers in the world, where on earth do I go if you're buying off of 40 different frameworks? Where do I need to pitch? Where do I need to be looking? How do I come into the system? How do you, the NHS, know you're getting the best value and the best product or the best services? So they did call me the Grim Reaper of frameworks, actually. I quite like that title. I thought that was quite good fun. I shall have a cloak and a scythe. But I got a grip on it, right? We went in and we went right through all the frameworks. We've done a lot of rationalisation. We now accredit those frameworks. So I used to call it the Wild West of buying. You cannot buy, something so important in that way. So we've got a grip on that. And the second case study on influence and scale was energy. So what was it? A couple of summers ago, when all of our energy prices, global energy prices, went through the roof, we had to find another 1.2 billion 1.2 billion the Treasury had to find, we had to find, to pay for the extra energy prices across the whole of the NHS. Gives you a size of the scale, right? That's, we use a lot of energy, even though it's another talk doing a lot about green and sustainability. But anyway, 1.3, and that was a good opportunity. I said, well, how are we buying our energy? And I took a look at it, and local. We were buying like local contracts all over the place. And this is just, again, really? So each hospital has their own energy contract. So I got everybody in the room. I got all of the procurement leads across, and I said, do you all agree that the way that we are buying energy, gas and electricity, is absolutely bonkers? That's a polite word, right? And everybody said to me, oh, yeah, it is. But nobody had actually sat together and said, so let's not do it this way anymore. You know, when you're sort of sitting there in the room, I go, are you all in on this? Everyone's absolutely. Cut a long story short, we then created energy baskets within Crown Commercial Services. We buy energy for the rest of the government. And we're now buying our energy as one NHS. It's absolutely fundamentally worked, and it is 100 million a year in savings from a 25-minute conversation with the right people in the room. And those are the opportunities in the NHS, and this is what I and everybody else in the NHS commercial and procurement, we've got the responsibilities to all of you to go after this. It's not just low-hanging fruit. Mobile phones, that's another good example. So when you look at it, again, each of the trusts and GPs, everyone's got their own mobile phone contracts. Now, I'm not necessarily saying everything should be bought nationally. That's not always the answer. But we did an audit, a couple of grand per trust to do an audit. I've realised 90 million in 6 months from contracts that either the person's left, no one's using it. It's this is not okay. And I'm being really open and transparent with you today. And we've been very public about this. But this is why we have to get a grip on it. This is why all of those low-hanging fruit and the NHS commercial and procurement can fundamentally change how it feels for you as a patient. Because I'm going to get the money. I'm going to get the money out of the supply chain. I'm going to get the money out of inefficient commercial buying. So very, very exciting what we're doing. Another big shift, there's a Procurement Act coming. It was supposed to be launching the end of October, but the new government's moved it to the end of February 2025. It is one of the biggest transformational acts in procurement in the government for the last 40 to 50 years. We had to do this anyway because of Brexit, because of coming out of the EU. I'm very proud I've been part of what that new act looks like. But if you are a supplier or you do any work with government and you haven't looked at the new Procurement Act, please go on the government website. There's brilliant videos, 10 minutes for you all to have a look, depending on who you are, supplier, SME, exactly what it's going to mean. And it is fundamentally changing the way that the UK government is going to buy. So very, very excited about that. It's going to be very transparent. We're probably going to get a lot more challenges, but a lot faster, a lot quicker, and more effective, and a lot more dynamic with our contracts. So that's another big shift. The strategic framework for the NHS, I talked about this a little bit more in terms of the commercial strategy and the framework and setting out the ambitions and the objectives and just making sure everybody understands and everybody's on that same path. Supplier engagement has been really important since I've come in. We've been doing a lot of work around our SSRM, around our SME action plan. I now work with all of our industry bodies, and I think for a while they felt, prior to COVID, a lot of our suppliers felt not really engaged. COVID, all of a sudden, everybody was engaged because we brought everybody around the table. How do we do this together? And then after COVID, it's kind of reverted back a bit. So it can't. Suppliers have to be part of our solutions. We've got a very big supplier engagement program. Digital and transparency and AI and medtech. This is massive for us. Do you remember when I talked about the 3 shifts? I'm not going to test you, but one of the 3 shifts was analog to digital. We have to digitalise the NHS. We do virtual wards, but that's it. It's not virtual hospitals. I've been all over the world looking at other countries that have got this down to a T, and it's absolutely brilliant. In terms of our NHS app, hopefully you've all got that, and you're now booking your doctor's appointments and your prescriptions. It's pretty basic. Right? It's pretty basic. We need to invest the time and the money in all levels of technology, your patient records, so that you go into your GP or you go into one hospital and you go into the other, and all your clinicians can access your same patient records. And the list goes on, let alone talking about new digital and technology and AI. You may have seen on the news last week, I'm absolutely delighted to be part of the new technology that we're doing with virtual headsets to create for our neurosurgeons, and actually where you scan the body and then our surgeons wear headsets, and it's literally like looking into somebody while they're performing the surgery. There was a very successful conjoined twins separation last week in Turkey using this new technology, which, and that's just one of them. I've got thousands in the NHS, so we have to, this has to be a massive focus for us on AI and technical. And then finally, and I promise this is finally, workforce development. We have to attract and develop a really diverse commercial talent. This is one of my priorities as well. Our people deserve to be invested in. So there's 4,000 of them, and and that development for their future careers. And so I've just launched last week, really exciting. We've just launched the first ever of its kind in partnership with Crown Commercial Services, a NHS Commercial Academy, so that I can put all of our people through the right training. They can get accreditation, they can get their MSIPs, for example, so that I'm actually professionalising and bringing the entire community on. Because all the things I've spoke about today, I need the right, we need those good people. We need them to believe in the vision. So very excited about that. The NHS, I want that to become a career of choice. Often, I spent 30 years in the private sector. I was a banker before I decided that government was the place I needed to be. So, we do struggle sometimes from pay perspective against the private sector. But I do want to bring the best talent in. I want to bring them in. Develop them, and of course ultimately retain them as well, because the government and the NHS needs these people. So in conclusion, yes, the NHS has got its challenges. Thank you very much for letting me share those today. We know what they are. We're really clear on what they are. We're really clear on our plan to fix it. And as we're going through that process, we've got to continue to deliver those improvements. We've got to continue to change ahead, like with the Procurement Act and AI and technology. And our role as buyers, and I say to our suppliers, to the NHS, it's more critical than ever, given where we are. So we've got to be radical. We've got to be transformative. Can't be because it's always been done that way. More than we have ever been for the last 76 years of the NHS now. So I'm really excited to be leading this. I'm really excited for all the improvements and the progress we're going to make for us all to work together. So ultimately, it's for the good of our patients. That's what this is all about. Everything I've spoke about today, it's about the front line. It's about the patients. So thank you very much. Appreciate you listening for me today. Thank you.
Jacqui, thank you very much indeed. We will go to the room quickly for any questions. We have one at the back. We need to get this for the stream, so people joining us virtually will still be able to hear. Thank you.
Thank you, Jacqui. Brilliant talk. Question about the change of government. It's kind of 3 months in now. At the top levels of the NHS, how much has this changed any of your kind of strategic priorities, or actually as the course was set before, is the course continuing?
Yeah, it's a really good question. It's actually pretty exciting. I'm not actually a civil servant now, but if I was a civil servant, obviously I'm completely neutral in terms of the government. So I'm not going to say anything political here. But I think the opportunity for a new government coming in, and then, the new government, Wes Streeting, who is our new Secretary of State, to ask Lord Darzi to do this review was really good. It's really good news. We've recognised for a long time where the NHS is after COVID. We're working it. We know how it feels. Most of you are receivers of it. You know where it's working and where it's not. So I think the new government, it's not suddenly magicking up money. It's not suddenly magicking up funding, but it is being very, very focused on, well, we need to reform. We need to reform the NHS. So it's been quite a breath of fresh air, to be honest with you. We've done a lot of focus groups with all of our new ministers. Sitting down and literally going through, whether it be mental health, maternity, cancer, diabetes, all of the different pathways that we're really, really focusing in on now, children and young people, the ageing population, I could go on. So it's been quite good for us as well in the NHS to have to almost, this is a new minister. Where are we at? And the questions that they ask is really, and of course they're asking a lot of questions around the supply chain and the commercial as well. So, I'm ever the optimist. I always think, a changing government. These are people that want the best for the country, whichever colour government they are. So it's for us to work with them hand in hand to make sure we deliver that.
Jacqui, that was a diplomatic answer as well. The next question was here.
So you spoke about the NHS and getting people to have that as a career option. For me, it's around how do we retain procurement and procurement to be a choice. So I think it's something that most people fall into. And actually what we want is those creative skill set that's really niche. So how do you get procurement and, attract people that haven't considered it as a career?
Yeah, really good question. And you're right that you hear that narrative so many times when people say, how did you get into procurement? Oh, I fell into it. I didn't fall into it. I made a fundamental decision. That was where I was an accountant, trader, and it was a decision. That's where I want to go. I like buying things, quite frankly. So I thought, oh, this would be fun. Let's buy for a living. You're right. It still feels like people sort of go down either the accounting path or whatever, and then they just sort of like end up in procurement. So what we're doing is we're very, very focused to go into the universities, actually go into the medical schools as well, because some of our best procurement individuals are nurses and are clinicians, and they've got their medical qualifications as well, and then they move into procurement. So there's lots of different channels to come in, and I think that's right across the government as well. I think the government is fortunate. I mean, how exciting. You can come in, 2 years ago I was buying submarines. Now I'm buying for the NHS, so I buy warships. So it's really exciting in the government. But as you say, there are those challenges. So we need to be very deliberate about making sure that the offering and the package is there, making sure, the package both financially and career progression, making sure that we support people through their careers. And so when they take a job in procurement in the government, they know that they're going to have a very determined path, and they will get to those MSIPs and further chartered qualifications, because that's really important for people. So yes, it's always a battle, but I try and do as much talking about it and out and about with young people in universities and schools as I can.
Sorry, if I could just get the mic to you, just so our streaming audience can hear.
Do you not think it needs to be before that university? So when, just for example, from my daughter, and I also fell into procurement as, I think it was like shopping on a big scale.
Yeah.
Why would you not? But my daughter at 16 is looking at her options, and never once does she think about these careers that are outside of that scope, because we don't do anything in schools around budgeting, around value for money. So actually, can we look at school level and take it to the next bit?
Yeah, really good idea. And I am working with the Department of Education on that as well. Actually, I do go to schools. So I went to my old school, which was an interesting school in Walthamstow, although Walthamstow's become very upmarket now. It certainly wasn't when I went there. And I went back to my old school, and I was talking to the sort of the fifth and sixth formers. And of course, the first question that always goes up is, how much money do you earn? Which I thought was quite funny. I thought, no, can we not much? Can we not talk more about the buying? So yeah, I'm with you on that. And I am talking to the Department of Education on many aspects of how we get the NHS and NHS careers into the schools, trade fairs, etc. Because again, not just in procurement, we've got a problem with people coming into medicine now. A lot of problems with people going into medicine. Not so much nursing, but people going into doctor, doing their medical doctors is becoming a challenge.
Okay, thank you, Jacqui. We've had 3 more hands, one close there, one at the front and one in the middle. I'll go through those and then we'll wrap things for this session. If we keep these questions relatively short and sharp, I'd be very grateful.
Thank you very much. My name is Sarah Habib. I'm into healthcare provider. And my question is, what is the future plan for providers, instead of going through the social services, how they can get direct tender through the NHS?
Yeah.
Thank you.
Yeah, very, very good. And you're right, and what has come out I don't know if you read the Lord Darcy report. I would recommend, it's only 163 pages, and I don't say that. It's good. Yeah, but if you're in healthcare, it's really, really good. And these pathways in and how healthcare providers, it's mentioned, and it's going to be part of the reform. So I haven't got the absolute answer for you now, but we recognise that it's too fragmented and it's too difficult quite often, and the pathway in, whether you come through social care, through DHSC, whether you go in through a trust, that is recognised, and it will be part of the reform.
Thank you. I think there was a question at the front. There was. I thought I'd made that up for a second. Thank you.
Thank you. Hi, Jacqui. I'm Darren Lee from Unipart. Just wanted to say, a fascinating talk that you've just given, very insightful and inspiring. Thank you for your honesty and transparency about the inner workings. I thought it was great to hear you talking about efficiency and productivity. And that's something that we're also very focused on within our business. I think it's clear that the NHS are very lucky to have you, just by listening to the way you speak, and I think we're all very lucky to have you. My question is, when it comes to efficiency and productivity, with the new Procurement Act coming out and the fact that you have to deal with public procurement processes, how do you get comfort that that's going to support your efficiency and productivity drive?
Yeah, quite a lot actually, because I think if we buy differently under the Act, ultimately that should result in more efficiencies and better productivity. That has to be the front of everything we do. I think the fact that we're in the middle of training everybody, just stop buying in the old-fashioned ways of buying. And of course, I've got to give them technology as well, but the way that we can be far more dynamic in our deals, far more win-win, take more risk, and shared risk with our suppliers, and then buy things more centrally, or bring in more innovation. All of that is going to lead to efficiencies because it's going to lead to better buying. And it's going to start raising the question, when you start going into, again, I'll use the chief exec of a trust, and you go in and you show them their spending, and you show them the variation of what they're spending on the same products and services to a trust in the next county. Everybody wants it. Then all of a sudden, commercial and procurement becomes front and centre. They go, tell us more, Jacqui. Tell us more. Where's that low-hanging fruit? What can we go after? How can I get this money back to the front line? And I think the Procurement Act is just going to professionalise everybody in government more than they are already, because you have to be. Because I tell everybody, you better be ready, everyone, whether you're in defence or you're in education or you're in transport or, you're in healthcare, because our suppliers know what's in the Act. I know a lot of you will. I saw a lot of nodding heads. A lot of you will know exactly what's coming if you do work with the government. And if we're not ready, that's going to be disastrous, because suppliers are going to be demanding that we buy in a different way, in a more proactive, efficient way, because that's better for suppliers as well. I mean, you imagine if you're selling the same product to 220 different trusts. Imagine the size of the pitch teams you've got to have. Imagine it's just, oh my God, it's just draining on everybody. So I believe, the Procurement Act's come at just the right time for the NHS reform. And it's my job and everybody else's job in our team to make sure we leverage that. And it's not just a tick box exercise to make sure we're compliant, but we actually, I want to be the kind of the rule breaker and sort of the pilot, and just take it further than everybody else, especially my old lot in defence.
Thank you, Jacqui. Last question here in the middle.
Jacqui, afternoon. Jay Perkins. First of all, I think I speak for most of the room when I say it's clear to see that there's a whole lot of passion you've got for the role you've played in this transformation with the NHS, and it's probably not done yet. But But I'd be interested in hearing a little bit more about how effective a part the digital transformation of the commercial function played in this journey. And it must be a very, I guess, complex environment to maintain governance across these new strategies you place. How did the digital transformation play a part in that?
Yeah, thank you for asking. So when I first came in, and the first question you'd expect any CPO to ask, show me the spend. Show me where I'm spending, what I'm spending. And they went, it's going to take us about 4 or 5 weeks because everyone's on different platforms. Everyone's on different systems. I threw my arms up in the air in a little bit of despair. So one of the first things we did is we've put in one single system now. And everyone's going, Jacqui, they won't take it. Well, they did take it because I paid for it. So now the NHS, everyone is on one particular e-commerce platform now. So for the first time in 76 years, I can look at any piece of spend. I can look at our pipeline. It's really simple. Right? And you might be aghast that we didn't have that before because everybody was on different platforms. But the difference that has now made into our strategy in the field. So that's just the first thing. That's the first thing. There are, our technology, our architecture, our inventory management systems. When you look at NHS supply chain, the scanning of all of our products, it's not where it needs to be. So I do have a very, very clear, along with the rest of the NHS, kind of IT, digital transformation, AI roadmap. The challenges are the funding for it. Now, I've always got to, where do we spend the money? That's always difficult in the NHS. Are we going to give Jacqui, X amount of millions to bring in a new e-buying tool, or does it go into the front line? So as long as we've got the right return on investment and the right business cases, it will be funded. So yeah, I've got a whole plan of that. But it's quite a way behind. I'd say it's 10 years behind when I was in the private sector. But let's recognise that. Let's work with what we've got and let's start building and making sure we get the right products in.
Okay, Jacqui, and apologies, we are going to have to wrap things there so we can get to the lunch break. You've been incredibly generous with your time, so thank you very much for that. So, Jacqui Rock, Chief Commercial Officer and Grim Reaper of Frameworks. Let's include your full title.